Welcome to our webinar on figure skating injury management. We're so happy to have Taylor Curran, a physiotherapy resident, with us here to speak about figure skating injuries. So Taylor, tell us a little bit about yourself and what you're going to talk about today.
Yeah, for sure. Thank you for kind of introducing me a little bit. I'm really excited to talk on this topic. So a little bit about me. I am a physiotherapy resident here at Fit for Life Physiotherapy. A little bit about my educational background. I did my undergrad in kinesiology at Trent University. And then most recently, I just recently graduated from McMaster in August with my Master's of Physiotherapy. And I decided to stick around in Burlington and help kind of be in the community and stay in the community that way. But the reason that we're here today is to more talk about figure skating. And the reason that I'm really interested in this topic is I am a former figure skater. I skated competitively for about 10 years, just in singles free skate. And I was a member at both the Ajax Figure Skating Club and the Scarborough Figure Skating Club growing up. This topic is really important to me because I felt like growing up in the skating community, injuries weren't always discussed or talked about. That made it kind of feel like a safe space for skaters to bring up what's going on with their injuries and how that's impacting their competitive season. So I feel like now with my kind of knowledge and experience of the figure skating world, as well as the knowledge I've gained through both of my university degrees, I can kind of help to build a bit of a bridge to fill those gaps and needs for skaters in that regard.
Sounds like something really important that might have been useful for you at some point in time.
Yes, absolutely. I had a few minor injuries along the way, and then for more serious injuries like an ankle fracture, I did seek physiotherapy care. But even at that time, I felt once I kind of got back to the ice, I wasn't always consistent with my rehab, so could impact some performance long term.
We always learn from
Yes.
so this is great that you're going to be able to provide some information and help for some skaters and in getting them back to skating, without injury and recovering from injury well. So looking forward to hearing what you have to say.
Thank you. Yeah. So to kind of go through it a little bit, here's a little bit of a table of contents for some of the things that we'll be talking about. So first, we'll kind of go through a little bit of background on the importance of seeking care and injury prevalence in skaters. And then 4 different areas that I think are really important for injury management within skaters, and then kind of ending off with a little bit more on advocacy for skaters and seeking rehab services. So to start off, the first thing is kind of why we're seeking care or what's the importance behind it. So I think that injury kind of management and prevention for skaters can be quite complex just due to the nature of the sport in general. Falls are kind of inevitable. Even if you're the best skater on the ice, there will be days where you fall on all of your elements, and that's just kind of the way it goes sometimes. So I think an important aspect is maybe not how we can be absolutely perfect on the ice, but how we can best prepare ourselves for those falls and how we get up from those falls, which kind of ties into my first point on the slide with skater longevity. I think injury management is really important for keeping skaters in their sport through their competitive season and through the off season, doing all the training that they need to, and making sure they're able to stay in the sport for as long as they wish to. And the other important aspects of seeking care would be to kind of improve skaters' understanding of injury management, especially with those more acute injuries. A lot of skaters tend to suffer from more chronic injuries. So if we can address them in the acute stage, it might help them to, again, better their performance and keep them skating in a healthy manner for longer. And then kind of also helping with that skater advocacy and making sure that skaters know there's healthcare services out there to help them be their best alongside their coach's guidance as well. And then a little bit more to kind of speak on some more research to kind of back up what we're kind of discussing today. Just in general, in the figure skating world, it is very common for skaters to have injuries and kind of skate through them throughout the season. But a more recent article by Madsen et al. Looking at the epidemiology of injuries in figure skating, they looked at all disciplines, so singles, pairs, dance, and even synchro skaters. This article showed that there's almost an 80% lifetime prevalence of injury for all skaters in all disciplines, so not just specific to one. Usually there's about an annual rate of about 56.6%, so very close to 50% injury rate throughout a year or a season. And then some other interesting points from this article was that single skaters are more likely to develop chronic injuries in comparison to more acute injuries out of all of the disciplines. And then more common injuries amongst all skaters are kind of lower extremity injuries as well as back injuries. This research was completed in Florida in the United States. So there might be some discrepancies in Canada, but I think it kind of highlights that there is a really high injury rate with among skaters, and it's important that we kind of have strategies to address them.
Seems like it's clearly a problem that there's a lot of injuries that, and a lot that develop into really chronic injuries that hopefully that's something that we can prevent. Is that like your experience in sort of your own experience in skating? Like, is that something you would see, look at these numbers and think, oh yeah, I saw a lot of people with injuries that kind of just stuck around for a while?
Yeah, I think a lot of the times when I was skating, it was very common for a lot of the girls and boys to have more of that like chronic back pain or a chronic more like Achilles tendinopathy that was really irritated. And it would kind of just be we know this pain exists, but competitive season's coming up and we don't want to kind of lose out on our training. So kind of those maybe quick fixes or just pushing through was often very common.
Right. Yeah. So somewhere where you as a physiotherapist can have a role in helping him in that, for sure.
Yeah, absolutely. So kind of the next steps are kind of talking about things that we can do as physiotherapists to help skaters kind of implement some more long-term injury management strategies. So the first one that kind of comes to mind for me is talking about more warm-ups and cool downs. Like a lot of sports, I think people are kind of moving towards a more dynamic warm-up just to get those muscles and tendons ready to kind of do any complex movements on the ice and kind of help with joint stability and things like that, especially in skating, whether you're doing ice dance or single skating. There's a lot of force going through your legs and upper body. So getting those things warmed up so that we prevent any on ice injuries is really crucial. So some things that I had thought about, I mean, we all live fast-paced lives, so making something that's effective but also time effective is most important. So often we practice a lot of jump rope for warm-ups and different things like that. And even for upper extremity, doing some push-ups or handstands, things like that. And then another thing on ice, I mean, it wasn't always my favorite thing to do, but a lot of stroking and skills skating edges practice like that. I think a lot of us skaters tend to jump right into our elements and doing the more, I guess, fun things like our jumps and our spins, but still remembering that our stroking and edge work is really important to get those muscles ready to complete all the fun things that we want to do, especially because flexibility is a really important thing in figure skating, especially for those more complex poses and spins that we want to be doing to get those higher points in our competitions. And then some other things in terms of cool downs and more working on maintaining our range of motion and flexibility. I think those are kind of when the more static stretching comes into play, and just making sure. I know a lot of skaters are working towards either getting their splits or maintaining their splits, which can lead to some injuries if we're not doing it in a way that's progressive and slowly building up that muscle tolerance to being in those positions. So I think having a good routine of a few different stretches and positions and making sure we're holding them for somewhere in between a minute to 2 minutes for the positions to make sure that we're kind of easing into those things and not I guess overstretching, creating any muscle strains and things like that during our split progressions. So those are kind of the things that I had thought about for our warm-ups and cool downs. And then the next kind of piece for another injury management strategy is kind of taking a look at the exercises that skaters are doing when they're off the ice. Typically, skating is a really great form of aerobic exercise, and we're really pushing our cardiorespiratory system through sustained effort through both practices and competition with all of the complex movements that we're doing. But I think sometimes a piece to the puzzle that skaters often miss is adding in a little bit of strength training, just because that can kind of help to make sure our muscles are strong and we improve our joint stability as well. And I think adding in that resistance training can help with a lot of different aspects of skating, especially in terms of jumps with our kind of power to get off of the ice, as well as our rotational speed, and even throughout other disciplines of skating, ice dance, especially with all of the lifts that are completed, we need to make sure that we're strong enough to hold those positions. I think sometimes why skaters might shy away from this type of training is that skating, just the nature of it, it's a very aesthetic sport. It's kind of, you want to look a certain way on the ice, and I think when we hear resistance training, we kind of think of like big, bulky muscles or weight training, bodybuilders, but I think strength training can be a really important piece in maintaining joint stability. So I don't think skaters should fear it as much as maybe we do, and it's an important piece to the puzzle, and I think that people are starting to incorporate it more, but just having that encouragement can be really beneficial. And then the last point on this slide is kind of working in some more core stability exercises alongside that as well. And I think this type of exercise is really important just for in general, improving balance and control, especially with our landings of jumps, and making sure that we have enough trunk control to maintain an upright position. In skating, if you kind of touch your hand to the ice during your landings, you end up losing points. So making sure that core is nice and stable can help make sure we don't have any of those reductions. And it can also help with things like preventing injuries to the low back and hips, and making sure that those kind of forces we have on the ice are distributed throughout our body in a more even way, and kind of minimizing any strain on our joints or muscles. Another thing about core stability is we can really incorporate some breath work into it, and that can have a really significant impact on skaters' endurance, especially in relationship to like proper engagement of the diaphragm, and making sure that we're able to maintain our breath through that program, instead of holding our breath, making sure our muscles are getting enough oxygen to do what they need to do on the ice.
So how often would you suggest that a figure skater is including some strength training and core stability work into their training plan?
Yeah, absolutely. I think it can definitely vary based on the skater and how much, I guess, what their intensity of skating is and what their competition level is at right now. But I think 2 to 3 times per week, incorporating even 30 minutes of resistance training into what might be already a busy schedule skaters will see a definite improvement in their muscle strength, kind of targeting those major muscle groups. And I think that would be beneficial, as well as the same thing for the core stability exercises, kind of combining them, making sure that those are it's not unattainable for them in their current schedule, but 2 to 3 times per week is what I would recommend.
Okay, great.
Yeah. Okay, so then the next point is kind of talking a little bit about skates and blade quality. I think these are really our only piece of equipment as skaters. Our skates are what we value the most, so I think they play a really crucial role in our performance. And I think it's really important to have skates and blades that are best suited for you and your program, especially even with your discipline in skating. I know often there's different blades for skaters that are doing singles, where they're focused more on their jumps, and then blades that are more related to ice dance and focusing on the skills for that. So just talking with your coaches and making sure that your skates are what they need to be for what you want to do and what you want to include in your program. I think another important piece is kind of knowing when your skates need to be updated. I think on average, kind of depending again on what your level of competition is and how many times you're training a week, skaters often update their skates about like 1 to 2 years, if they're in that really high competitive level. And then sometimes for a more lower level, you can kind of, when you're first starting out, kind of get away with more like 2 to 3 years on those skates. And just making sure that, you know, there's no excessive bending in your skating or in your skates, and that they're just stable enough to keep you upright. And then kind of the later of that is when you do get your new skates. Often there's a period where you have to break those skates in, and they are often very uncomfortable and end up creating lots of blisters and cuts potentially on your feet. So I know from my own personal experience, when I would break skates and I wouldn't always kind of ease back into my training, I would be like, no, I can do the exact same things I did on my comfortable worn in skates as I do on my new skates. And sometimes that would kind of have some setbacks. And a big thing you kind of experience in skating sometimes is mental blocks. You have the ability to do the jumps or the spins, but you just kind of experience those times where you have repetitive falls and you just can't get over it. And sometimes I found when I got new skates, I pushed myself, and then I ended up having periods where I had these mental blocks and wasn't able to do all of my elements. So just kind of remembering to take it easy. You don't have to go back into your training full force when you get your new skates, and looking after your foot health is really important. And then kind of the last point that we have is also kind of ties into that taking it a little bit easy and knowing when to pull back. I think rest and recovery is really important for injury management, especially in some of those more acute injuries, to prevent them from becoming chronic. I think that often skaters tend to have a bit more trouble with taking it easy or taking a slower approach to their training, and it's totally understandable. I think all athletes kind of relate to that. They don't want to take a step back. It's always about the next goal or the next competition, and it's totally understandable. It's just finding those limits and boundaries of where you can continue to push yourself while continuing to be healthy and not progress an injury to the point where you're being told that you can't skate at all, or that you need to take a bigger time away from the ice. So I think that it's important that we kind of establish those guidelines, and that's kind of where a healthcare provider like a physiotherapist comes in, because they have the knowledge and understanding of those tissue and bone healing times. So they'll be able to kind of tell you what a rough estimate is to when you'll be able to return safely to the practice or competitions. And again, making sure you're doing that in a safe way. And then kind of just knowing when time away from the ice is needed to kind of prevent those the reoccurring injuries, to make sure that we're not having those overuse injuries or repetitive injuries. And I think that breaks can be both beneficial for physical and mental health when necessary. Not all the time, but when necessary.
Yeah, I'm sure this is an area I think that's hard for a lot of athletes, right? Where they just want to keep going when their body really does need a little bit more rest and recovery to get stronger. And that's when working with a physiotherapist who really understands your sport, understands the body, and kind of can let them work with them to figure out what's the right amount of training that I can do that's going to keep me moving forward, but not so much that it's going to prolong this injury or aggravate it, right? So yeah, such an important piece.
Yeah, absolutely. And like I said before, it's definitely understandable why athletes kind of shy away from seeking services or taking time off, because nobody wants to do that. That's
Mhm.
not our goal to tell you to do that, but we just want to make sure that you're doing that progression back into your full training session in a way that doesn't prolong your injury, just like you had said.
Right. And not maybe ending your time in the sport prematurely.
Exactly.
Yeah.
Yeah. And that kind of ties into my next point about skater advocacy. I think a lot of times skaters start skating when they're very young, and I think they don't always know that they can kind of speak up for themselves and say like when they think they need an outside person in a more healthcare rehab role to aid their skating and make sure that they're able to continue. I think a lot of times in figure skating, um, careers are ended prematurely due to chronic injuries, and it's just too much or too painful to continue doing the sport that they love, and it's not really their want to kind of end their career or stop skating, but it's just too much for them to continue. So I think that's where physiotherapists and other rehab professionals can kind of come in and aid that to make sure that they get to decide when it's time to hang up their skates rather than them kind of being almost forced into it. And so I think a part of that is kind of the first point on the slide there, identifying some early signs and symptoms. I think often in skating, we tend to hold back and kind of, again, skate through those things. And we're like, oh no, like, I know that I'm going to fall. I know that I can get back up and I know that I can keep going. But just making sure that we're acknowledging when things aren't getting better. Like, we can deal with our aches and pains and that sort of muscle soreness, but when they kind of persist and become more intense pain, we kind of need to take a step back and realize that maybe sometimes we do need extra help. And then kind of more red flag symptoms. So anytime that skaters have it can be common that sometimes you fall the wrong way and then you hit your head, and you need to kind of go through to a medical professional and make sure there's no other signs or symptoms going on, especially anything related to concussion. Definitely not safe to be skating with concussion when it first happens. So just making sure that we're taking the time to stop and take a moment and make sure that we're okay. I think we're often trained as skaters, when you fall, you get back up, but sometimes it's okay to take a minute and take a breather and then keep going. And that kind of leads into seeking more injury guidance or guidance on when to return to sport. So reaching out to a physiotherapist or a kinesiologist. One second, I just need a sip of water, sorry. Perfect, thank you. I think at the clinic we have both. So we have physiotherapists and kinesiologists, and they can kind of help you in different areas. Physiotherapists have exercise training, but they also have training in more manual therapy skills as well. And then kinesiologists can help with that more exercise progression as well. And then that also ties into the prevention of chronic injuries, and to kind of go back to the beginning of the presentation where we had talked about how skaters in single skating are more likely to have those chronic injuries. So if we can work to kind of prevent them from getting to that chronic stage, it's kind of prolonging their time in the sport, as well as improving their performance for that specific season or whatever their goals might be, if it's in if they happen to have an injury in the off season as well. Skaters often tend to have their competition season in the winter, and then in those summer months where they have more ticket ice, and sometimes some clubs have full training programs in the summer as well. I know that when I skated in Scarborough, we also had full training in the summer months. So just making sure that we're healthy all year round is very important as well. And some examples from that research study that were very common for chronic injuries were things like stress fractures or Achilles tendinopathy, and then also that low back pain that we've mentioned a few times. Something interesting about the stress fractures is that article found that these can often range from about 10% to up to 20% of skaters. So there is still a prevalence of those issues as well. And I think that overall with the advocacy piece, it's a lot of times skaters maybe don't always realize the services that they have available to them, especially from a young age. Like you just know what the people around you are telling you and what your coaches tell you. So if coaches are more aware of services in their city or around their clubs, it can kind of benefit their skaters to know as well and make sure that they have the season that they're hoping for. And then to kind of end it off, we have some of those resources that we talked about earlier. So the two studies that were by Madsen et al. In terms of the epidemiology of the kind of stats that were presented earlier in the presentation. And then, so if you want to go and look at them, I mean, I'm a nerd, so I like to read these things, but I can understand that not everybody likes to, but they're there if you want.
Well, and it's nice that you've been able to provide some of the key points that came from those studies, because you're right, not everybody wants to read the research, but it's nice to know that it's coming from a reliable source for sure.
Yeah, absolutely. So kind of to, I guess, wrap it up, I would just like to say that, again, I'm really thankful to have the opportunity to speak on a topic such as this. It's really kind of near and dear to my heart as a former figure skater, and it's somewhere where I think physiotherapy services can kind of, like I said before, bridge a gap for skaters and young skaters especially, and making sure that they have the season that they're looking for and be able to complete their sport for as long as they want. And I feel like with that knowledge and the knowledge that I have now as a physiotherapy resident, it can kind of come together and mesh together and make sure that skaters are competing in a safe way.
Well, thank you so much for speaking with us. And if anybody does want to work with Taylor, because it sounds like she would be a fantastic person to be working with if you've got sort of some little niggly injuries that you want to prevent them from becoming something chronic and maybe, shortening your skating season or your skating career, then, working with a physiotherapist who understands skating, who understands injuries, can really help keep you moving forward towards your goals. So you'll see here on the slide to reach out to Taylor either at her email or call the clinic directly. And whether it's starting with a free 15-minute consult or booking right in for an assessment to help you achieve your goals. So thank you so much, Taylor, for speaking with us. And I'm sure we'll hear from you again on some other topics, but thanks for joining us.
Yeah, thank you guys so much. And like Miriam had said, if you have any questions, please feel free to reach out to me at any time.